We're happy because we have a whole bunch of people in studio to talk about the Diabetes Alert Day Health Fair. Shared with you the public health release that went out, and now we have guests in studio. So first, thank you GMH for setting this up, and thank you SDA Guam Clinic for sponsoring this segment every single week. And we want to welcome Patrick Lucis, Program Coordinator for the Diabetes Prevention and Control Program. Hafa Patrick.
Hafa.
From the Guam Regional Medical City, Greg Woodard is in the studio. Hafa Greg.
Hafa.
From Mountain Pacific Quality Health, we have Aggie White.
Hi, good afternoon.
And from the Lions Club International number 204, Sume Kuba. Hafa.
Hafa.
And all of you guys, I want to stress really that diabetes as a non-communicable disease on Guam is a very big condition. We all know everyone that's touched with diabetes. We all have relatives that are dealing with it. And that's why I'm glad that we have so many partners that are coming together for this event that's happening this Saturday at the Micronesia Mall, Concourse 3. That's how you know that there's going to be a big event, because it's too big for the center court. Concourse 3 from 10 a.m. to 2 p.m. A lot of partnerships coming together. Patrick, let's start with you. Why is it important to have all of these I guess relationships and all of these partners coming together to help combat diabetes?
With public health, GMH, and the Guam Behavioral Health and Wellness Center, we can cover only so much of the island as far as diabetes and NCDs is concerned, and it's very important to be working with all our partners and all stakeholders throughout the island, and that's the only way we're able to make this possible, these kind of events possible. And resources are short, manpower short, but with all the partnership, man, we're going to have a big, successful event this coming Saturday. Okay,
and I think it makes sense to have all of the health people here in the studio. I'm interested, Sume, to find out, I know that the Lions Club has a lot of causes that it undertakes. What was it about this Diabetes Alert Day Health Fair that has the Guam Lions Club on board?
Lions Club originally formed to help the people with blindness.
Yes, for sight.
Yeah, for the sight. That is why the diabetic is a part of the major project, because the
cataracts and all of the vision problems resulting from diabetes.
Yes.
Okay.
So one of our major clubs called the Guam Marianas Lions Club, they have a free vision screening and also distribute reading glasses to who need it. Okay, so as part of the Lions Club outreach for vision care, you guys are going to be providing free vision screenings and free reading glasses. Right. Okay, that's awesome. Well, I know that a lot of people could definitely use that. I don't remember when the last time I got my vision checked, so I might just stop by the mall so I can have a free screening. What about you, Aggie? What's Mountain Pacific Quality Health providing for this fair on Saturday?
Well, I work as a certified diabetes educator, so we provide a lot of education and awareness. And Mountain Pacific is a quality health organization. So organizations that offer diabetes services, if they need consultation, they can call us, and we'll be glad to help them out.
So even businesses looking to offer services to patients can reach out to Mountain Pacific to find out more information about that.
They can do that because we have connections also in the community. As Patrick mentioned, we're part of the coalition, and as far as services, we can steer you in the right direction. Okay. I myself do a lot of diabetes education. In not only we have gone to the senior centers. Mountain Pacific has done that, and right now we're also going to offer training to coalition members themselves. One of the things
I love about this segment is really providing that information that maybe people are missing, or maybe people have a misconception. So since you brought up diabetes education, Aggie, what's the number one mistake, or I guess the number one misnomer that people have when they think about the condition of diabetes, or maybe like what puts them at risk for diabetes?
I think a big thing that people, at least on Guam, the big issue I think would be diet. And portion control and foods that would cause your sugars to increase, and foods that are high in carbohydrates usually do that. And people don't know that fruits are a source of carbohydrates. they think fruits are fine, so they can eat all the foods they want, and that's a misnomer. They think brown rice is better than white rice. Yes, most definitely, but it will.
But it's still a carbohydrate.
Yes, and it will raise your blood sugar. It doesn't mean you can eat all of it you want. They know that sweet potatoes are good for you, so they think they can eat all the sweet potatoes they want.
Right.
Right. So it's just educating people on sources of carbohydrates.
That's a good point, because some people are raised, and again, you know, my Nana, before she passed away, she was on a low potassium diet, and she wasn't able to eat dark greens. And again, you know, there is, when you're on restrictive diets, you need that re-education, because some things that you're grown up to know are healthy foods, not so healthful when you're a diabetic, not so healthful when you have these restrictive and therapeutic diets, because again, what's healthy for people without the condition may put you out of balance. Like you said, fruits are good, but they do have carbohydrates. So if you're eating a lot of fruit, you may want to cut more rice out of your diet, or cut the bread out of the diet, and not know that having a fruit would mean that you're increasing your carbohydrate intake.
Exactly.
Okay, and finally, Greg, I know the GRMC getting ready to open up. Are you going to be previewing some of the services that GRMC will provide when you guys are open over at the Micronesia Mall this Saturday?
Yes, we'll be providing screenings for people at risk for diabetes, and you know, if some people have some questions about the numbers they get on their screenings, then we have available, of course, the two main things with diabetes are stroke is doubled and cardiac risk is doubled. So we have both a neurologist, a Dr. Justin Hale, and a cardiologist, Dr.
Well, we'll have a
a
neurologist and a cardiologist going to be on site. So if diabetic patients or people that are, you know, that's what I like about the approach, though, because if I prick my finger and I get like a big blood sugar reading, I might freak out. So it's good that you have the doctors to.
We'll try to calm you down.
Okay, that's good. So it sounds like a whole lot of I guess opportunities, educational opportunities, and features provided at the Diabetes Alert Day Health Fair, again this Saturday at the Micronesia Mall, Concourse 3, from 10 a.m. to 2 p.m. And let's see, we blood glucose levels, blood pressure, body mass index, cholesterol checks, foot examined, and that's important for the circulation, right, for diabetics. Vision screen, chiropractic exams. That sounds like Patrick. What kind of chiropractic? Am I going to be able to crack my back over at the Micronesia Mall this Saturday?
Yes, we will. We will have a vendor on site.
Nice.
So yeah, I'll be able to do some back checking.
Adjustments.
Okay. And of course, the main thing is to do follow-up appointments.
Right.
Yeah.
And again, this is basically introducing people who may need these specialists or may need these services in the future, getting them acquainted with the right people, acquainted with the right partners in healthcare and the right services. So I like it because you're putting it out there to the people, and you're trying to make all of these what could be new services approachable, right?
Yes. The beauty about this is that in addition to what we see in our traditional health screening, once you go to your blood sugar, blood cholesterol, and all of that, and you start to see your numbers, usually that's kind of the end of it. This one here, we have a lot of the clinics and the doctors on site. So when you have that issue, go see the clinic or the doctor, schedule an appointment. The main thing is we really want you to go into see your doctor. When
we talk about the clinics and the professionals that are on site, I'm just going to run through some of the sponsors that are provided on the sheet. Mariana's Foot Care, Guam Visiting Nurses, Mountain Pacific, of course, in studio, the Lions Club in studio, GRMC in studio, Department of Public Health and Social Services, Guam Behavioral Health and Wellness, Tobacco Free Guam, Synergy, Stay Well, Net Care, Take Care, Select Care, GCC. So basically, anyone who has anything to do with health and wellness going to have a part of this healthcare. And again, do you have stats about how prevalent diabetes is on Guam right now out of the NCD's consortium?
Yeah, based on our BRFSS, we've been trending about 10% in the last 10 years. But in I believe in our 2013 data, we've seen a spike from 10% up to 14%.
Wow.
So looking at our adult population of 106,000, that comes up to almost 15,000. There is still another percentage that don't know they have diabetes. And
undiagnosed.
Undiagnosed. That could be an additional maybe another 5,000. So we're looking about maybe more than 20,000 people with diabetes on island.
Now, Aggie, let's say I have undiagnosed diabetes because I'm one of those people that don't go to the doctor every year like I should. What are some of the signs and symptoms that maybe should clue me in that I should go get this checked out?
Okay, well, for the signs of usually when people are diagnosed, they already have blatant symptoms, and that would be frequent urination, frequent thirst, excessive thirst, excessive hunger, vision, some alterations in their vision, weakness. But prior to even getting to that place, there's a stage called pre-diabetes.
Okay. What does that feel like?
Well, not that you feel like it.
Okay.
You catch it usually in your blood work. And before you're actually diagnosed with diabetes, you're in this pre-diabetes state, and it could be years, 5 years, 10 years in pre-diabetes state before you're actually diagnosed.
So there's plenty of time, like you said, 5 years, 10 years to catch it before it becomes a runaway train.
Right. If you catch it at pre-diabetes stage, just a simple 5-7% weight loss, research shows that you can slow down the progression of diabetes or reverse diabetes, but it's important to start doing something when you're at this pre-diabetes stage. It's not like, oh, I'm still fine, I can keep on going. No, it's a wake-up call.
And I think that goes to the point, and I'm glad that there's Synergy and Paradise Fitness going to be on-site. Quaker Oats, for instance, because wellness and healthfulness is such a big component about managing your diabetes. Isn't that right, Greg?
Oh, yes.
Yeah, and I'm sure that sort of information going to be key, especially if you're in the pre-diabetes age. So, and what's good is if you've been putting off a health screening or putting off your doctor's visit, you can go ahead and answer that question right away at this health fair. Okay, if you're just joining us, we have some of the participants from this weekend's Diabetes Alert Day Health Fair in studio as part of GMH Healthcare Heroes put on by the Guam Diabetes Control Coalition, the Department of Public Health and Social Services, the Guam Diabetes Association, and the Non-Communicable Disease Consortium, along with all of their great partners. We have some partners in studio like the Guam Regional Medical City, Mountain Pacific Quality Health, and Lions Club International, all in the studio right now. Seventh-day Adventist Guam Clinic, where your health is their mission, bringing you heroes of healthcare. Call 646-6881 for more information. We have traffic and news coming up, Patrick. So just as a closing thought, why should people consider going to the Micronesia Mall this Saturday?
We're seeing, in addition to our data, with our adult data with diabetes, we're seeing a lot of our younger generation in their 20s, and the youngest diagnosed with type 2 diabetes is 5 years old. So it's really hitting our younger generation. It's very important that we start to do things, the lifestyle change as a family. So we really want to invite everyone, bring the whole family down, and see how we can try to prevent and control diabetes for all ages and for the whole family.
Spend your Saturday at the Micronesia Mall from 10 a.m. to 2 p.m. Concourse 3 is going to be when and where the Diabetes Alert Day Health Fair is coming up. Partners from the Diabetes Alert Day Health Fair in the studio right now. Welcome back to our friends. We have Patrick Lucis, the program coordinator for the Diabetes Prevention and Control Program, Greg Woodard from the Guam Regional Medical City, Aggie White from Mountain Pacific Quality Health, and Sume Kuba from the Lions Club International number 204. Just some of the vendors and partners that you can meet at the Micronesia Mall this Saturday from 10 to 2 at Concourse 3. Again, free blood glucose screening, blood pressure, body mass index, vision checking, cholesterol check, foot examine, chiropractic adjustments, so much more, all here. And speaking of so much more, Patrick, you were talking about raffle prizes, talking about exercise on the hour, every hour. It seems like a really exciting event. Shaping up for Saturday.
That is correct. We will have a program for the hours that we will be there. So every top of the hour, we say take 3 at 3. So that's at 11:03, 12:03, 1:03. Okay. So we'll have our folks from Paradise and Synergy to do some Zumba, body combat, and then we're also working on trying to get some speakers. It is also Nutrition Month.
Okay.
And so we're trying to work with our Dietitian Association to provide some nutrition talk as well. Trying to see if we can bring some of the doctors also provide some talk. And because we will have so many vendors there, we do have the passport cards that you go to each vendor, get a little initial, and you have an opportunity once you fill that card up to win some nice prizes. So yeah.
Oh, okay. So is it like a door or a raffle prize? What do you get for filling out the passport?
We get some nice. We got some nice, good gift bags.
Oh, swag bags. Okay,
yeah, swag
everyone
bags.
loves that.
And it's filled with some goodies in there, and so yeah, come on by and.
Okay, also some incentives for the Government of Guam workers that are part of their Worksite Wellness program, right?
Yes, we are inviting the Government of Guam Worksite Wellness employees. You come over here and you have the opportunity to actually get 25 raffle tickets. And just to give you an idea, that the Government of Guam Worksite Wellness has a quarterly drawing. So for every event you do, you get so many raffle tickets. We draw it every quarter. You get the prize there is a round-trip ticket to the Philippines, and it's compliments of Guam Regional Medical City.
Oh, fantastic.
With 15,000 pesos of free service to the labs at the Guam Regional Medical City.
Okay. Well, I heard about how the Worksite Wellness program is getting people involved in the government to have a more healthy and active lifestyle, and I think with incentives like a free trip to the Philippines plus 15,000 pesos worth of services, that sounds great. So thanks to GRMC, and I hope all the Government of Guam workers are listening right now.
Yeah, I do gotta. I also have to recognize the other health insurances that have been contributing. Select Care is offering 5 $100 gift certificates to Payless.
Okay.
And then Take Care, they are giving I believe it's a cell phone and other gift bags.
Okay, well, it makes me want to be a GovGuam worker.
I do want to tell you a success story about the program.
Please do, because it is, with all these incentives and everything like that, a lot of government workers are getting on board with the healthier lifestyle.
Yes, in 2013, we only had about a little bit over 200 that registered into the program. And then when we worked with our partners again, and we had these nice incentive prizes. In 2014, we hit over 1,000 employees in the program now.
Wow.
And so 2015, we're hitting the ground running again.
Okay, well, perfect. Again, if you're part of your Worksite Wellness program in the Government of Guam, 25 raffle tickets going to be given to you as part of the quarterly drawing for attending the Diabetes Alert Day Health Fair this Saturday. Speaking of good causes and good things to jump on board, Sume, we were talking during the break, the Guam Lions Club took out, assisted by the talented high school students here on Guam, and now a way to help Lions Club fundraise for your diabetes programs is by recognizing a talented student from JFK. So if you want to point it to that camera over there, a really beautiful diabetes awareness T-shirt. Healthy living is a key, and Sandra Baccaran is the winner of the design, and she's from JFK. So how can we try to get this T-shirt? Again, it's a fundraising event for the Lions Club.
So you can reach me.
Okay.
483-7371.
Okay, 483-7371. Get your T-shirt today, and it goes to your diabetes outreach events, right?
Right. And then during this Alert Day, we will present a top 10 design.
Okay.
This is only the
one chosen,
but the top 10 design will be displayed.
Okay.
So all the students who participated to get this theme of healthy living, they will be seen, so you can come over and
so help support all of the local kids who donated their talent and to the Lions Club by going to the health fair today. They're going to be displaying the top 10 designs for the T-shirt, and you can call Sume. Give your number again so people can make sure they call.
Yes, 483-7371.
Okay, 483-7371 to get your shirt from the Guam Lions Club today. Greg, you were talking during the break too. A lot of people sort of write off diabetes as maybe an old person's problem or a disease for the elderly. But as Patrick was mentioning, the youngest case of diagnosed type 2 diabetes on Guam is 5 years old, and there's a national and a local trend of younger and younger people being diagnosed with diabetes. And I'm sure places like the Guam Regional Medical City don't want to have this disease, be something that you deal with for 40 years, for 35 years, and I'm sure GRMC has some thoughts on how to make sure that we maintain a healthy lifestyle for our young kids.
Right, and that's like the dietitian was talking about earlier. You want to avoid carbohydrates. I know when your child wants something, like a candy bar, sometimes it's easier just to give in, but maybe it's better not to do that.
Yeah.
I mean, I've got a daughter. I know when she wants something, you want to give it to her, but it's not always best.
Well, Aggie, you know, we were talking about the break about, and again, during the conversation, that diet and health and fitness is such an important part about maintaining and controlling diabetes. You had a very, very simple way of saying how we should healthfully put our plates together, and so when I'm thinking about portion, and you think, well, this is supposed to be a third of a cup, and I'm supposed to have a half of a cup of this, and I'm supposed to have 2 cups of that. It's hard to visualize that. So I think when you're talking about how to portion out your plate, that seems like the very simplest explanation to figure out what to do.
Right. So the next time you're in a buffet line or at a fiesta, you get a plate. Divide the plate in half. Half of it should be filled with vegetables.
Okay.
And then the other half, you divide that in half, so you have a quarter. The quarter space should be your starch, so it'll be your rice or your tortilla or your
potato salad, or
potato salad,
kamuti, or your favorite starch,
or your lemai, whatever. And then the other half should be your protein, so that would be your chicken or your fish or your ribs or whatever. But a rule of thumb is you're not supposed to stack things up, okay?
So
if all the white spaces on your plate is filled, that's all you get.
Okay.
And don't go back for seconds.
So you can't say, well, Aggie said that it's only supposed to have a quarter of the plate, so even though my quarter of the plate is 5 inches higher than the plate, it's still a quarter. That doesn't count, right?
Doesn't count.
Okay. And you also had it's mango season, and you talked about how fruit do carry carbohydrates. So there's a quick thing if you're diabetic and you have and you want some mangoes, green or ripe, it doesn't matter. What's a portion size, a carbohydrate choice size for mango? 1 serving is half of the mango. Okay. Okay. And also, if you have a melon, cantaloupe, honeydew, watermelon, 1 cup is 1 carbohydrate choice. Okay. Just 1 cup of that, not. And again, everyone thinks fruit as a healthful, healthy choice, but again, we have to recognize that fruits have carbohydrates, and carbohydrates aren't your best friends if you have diabetes. So you got to make sure that you keep it in control, because you said some patients freak out. They had the delicious mango, and then they wake up the next morning and their blood sugar is spiked. Exactly. So half of 1 mango is 1 choice. Right. Okay. But bear in mind that fruit is a better choice than a piece of cake or a donut. Because there's more nutrients in fruit than a donut. Well, and a piece of cake is 1 serving. It's only a 2 by 2 inch square. And you get a whole half of a mango as 1 choice if you eat a fruit instead, or a whole cup of melon if you do the fruit instead. So you can eat more fruit than you can cake is the point. Exactly. Okay, got it. June Perez, our friend June Perez from GMH on the line. If you guys want to get into the conversation, you can put on your headphones and everything like that. I don't know if she has a question for you guys, but Hafa June, thanks for setting this up. I'm having so much fun talking about how people can get healthy and join the Diabetes Alert Day Health Fair on Saturday.
I know. Gosh, Phil, I wish I was there. Thank you so much for making sure GMH Healthcare Heroes continues, and we're always there with you in spirit. And I just really wanted to personally make a shout out for the Diabetes Alert Fair this Saturday and the wonderful team that you have there, and to just really thank Patrick Lucis and Dr. Sangalang for heading up the Diabetes Coalition group, and of course all the wonderful people from the Non-Communicable Disease Consortium headed up by Rosie Zabala that oversees basically the whole umbrella group that's making these events, and these wonderful people that you have there before you continue to do the terrific work they do, and specifically for this Saturday focusing on diabetes and just getting the information out to our public and to our families on how to prevent and control and prevent and just really try to get this disease out of our lives and off of our island by just really making some more positive choices with our families and our lifestyles. You've got a great group there, and I really want to thank our partners with the Guam Regional Medical City, Greg Woodard, and of course my good friend Aggie, and the Lions Club representative there, Sume Kuba, and of course Patrick, you always come through. So I want to thank you all, and of course SDA, our sponsor, and Phil for making our outreach every day on health possible, and of course every week with our show. We can't do it without you and K-57. So thank you guys.
Oh, thank you, June. Okay, have a good day. I know, yeah, June goes, I wish I could be there, but we have a board meeting that I have to prep for. I know the life of a government worker, really hard. So it's 5:52 in the afternoon again. If you're just joining us, we're doing Heroes of Healthcare, covering the Guam Diabetes Alert Day Health Fair this Saturday from 10 to 2 at the Micronesia Mall, brought to you by Seventh-day Adventist Guam Clinic, where your health is their mission. Call 646-6881 for more information. While we're talking a lot about preventing diabetes, and when we're talking a lot about how a healthy lifestyle, can save a lot of headache and heartache down the road, but we don't want people to think that diabetes is a death sentence or diabetes is something to be depressed over. It's very treatable, very controllable, and it doesn't have to, just simple lifestyle changes can make sure that you stay happy and stay healthy, right?
Exactly.
Okay, yeah. I just wanted to put it out there, right, Patrick? We don't want people to get discouraged or thinking that diabetes is the end of the world.
Of course not. We have many people that are able to live with diabetes for so long. I mean, my father has had diabetes for over 40 years, and he's one of the champs. Carl Butler's another champion, so we can learn from these guys and live a long, healthy life.
Again, just about changing your diet, making sure that we exercise, making sure we maintain a healthy lifestyle.
Well, even the technology today and the medications.
Yeah.
There's a whole arsenal of different kinds of insulin analogs. There's different kinds of medicine you can take by mouth, that are very effective. So, I mean, if you want to be diabetes now, have diabetes, it's better to have it now than it was 20 years ago.
Well, that's true. And Greg, one of the good reasons why GRMC and the other health insurance companies are going to be there is because if you are diabetic, you're able to talk to the people that are going to be providing the treatment and see what services are out there, and how it is a very approachable and doable, and you can deal with the disease now.
Right, like she said, the oral agents. Everybody, when they think diabetes, they think of an insulin shot. And that makes a lot of people nervous. But most of the time, it can be controlled with oral agents and diet, of course. Well,
and just the technology about checking your blood sugar now. You don't have to pull a whole liter out of your arm in order to make sure that your blood sugar is all right. So all of the normal things and the course of events that really people were scared about, taking the insulin, checking your blood sugar, has been made so much easier and so much more approachable thanks to the technological advances that we are. So as Aggie's pointed, if there is a time to be diabetic, not that there's a time to be diabetic, but now is definitely better than before.
Yeah.
Okay. 1.5 minutes left to the top of the hour. Patrick, I'll give you the last word, just to invite everyone to come out to the mall on Saturday, and to thank your sponsors for the Diabetes Alert Day Health Fair.
Okay, just real quickly, this is again brought to you by the Guam Diabetes Control Coalition, the Guam Diabetes Association, the Department of Public Health and Social Services, the Non-Communicable Disease Consortium. I did want to give a shout out to Dr. Sangalang, our chairperson for the coalition, Carl Winnie Butler, and then Mayor Scott Duenas, who is the chair of the Guam Diabetes Association. Come on out this weekend. It's free to the public. We want to invite all our government employees. Your health coaches will be there. You have up to 25 tickets that you can earn. And if you want any more information, give us a call at the Department of Public Health and Social Service at 735-7265, and we will see you there.
We'll see you all on Saturday, this Saturday from 10 a.m. to 2 p.m. Micronesia Mall, Concourse 3. A whole bunch of services for free. A whole bunch of a swag bag you can get. 25 tickets that go toward a trip to Manila for government workers. I mean, I can only say good things about why you should check out the Diabetes Alert Health Fair this Saturday.
Yeah, Concourse 3 is actually below the movie theaters.
Okay, so Concourse, so everyone knows where the movie theater is, right underneath it.